Now that Pfizer has opened eligibility for kids ages 12 through 15 for its two-dose coronavirus vaccine, parents may have questions about whether or not the vaccine is right for their child.
And of course, we always want to know about all potential side effects or issues that could come up, especially when it comes to our children.
Morning anchor and health reporter Kirsten O'Connor is off today, so ClickOrlando.com's Brandon Bowles is standing by now to ask a doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
Health officials say vaccinating children will play a big role in reaching herd immunity against COVID. According to the American Academy of Pediatrics, children make up about a quarter of the nation's coronavirus cases. As many local districts aren't offering hybrid learning options next year, now is the time to start considering the vaccine to best protect your children and family when they're all back in the building. And we asked Arnold Palmer Hospital for Children pediatrician Dr. Jean Mourjani about what parents need to know, and she says the first thing you need to know is the timing of the shots is everything.
I think it's awesome to obviously get the vaccine as soon as it's available for your child. And definitely just make sure your pediatrician is aware, because the timing is really important with the COVID-19 vaccines and other vaccines as well. So for example, if your child is 12 or entering 7th grade, a lot of schools and states will require a certain number of vaccines to enter. And there's a certain window of time where you can and can't get vaccines around the COVID-19 vaccine. So as soon as it's approved or as soon as it's eligible for your child, definitely get in touch with your pediatrician so they can figure out an optimal time schedule to make sure that your child gets the vaccines necessary for school and the COVID-19 vaccine as well.
We also talked about the side effects many people have been discussing when it comes to the COVID vaccines, sore arm, headache, etc. As a pediatrician, Dr. Mourjani is used to giving vaccines that kids need for school, and she says those side effects are actually a pretty normal reaction to vaccines in general.
I think every vaccine has, I even hate to use the term side effect because it's just what it does. For example, I don't know if you remember getting your Tdap vaccine or not. I remember when I got it, like that is just one that typically that will make your arm really sore. So do I consider that a side effect? I don't know. I think that's just what it does. Like everybody has a sore arm after the Tdap. So if it happens to you, it happens to many, many other people also. It's just kind of what happens. And I think that the same thing with the COVID vaccine.
Now, we know there are a lot of people who still have a lot of concerns and questions about the safety and effectiveness of the vaccine, and we have a lot of resources with the facts on ClickOrlando.com. There may be even some disagreements amongst family or parents on whether kids should get the vaccine. So how do we talk to other parents who are still hesitant to get their kids vaccinated?
I think that most people that I've talked to that are vaccine hesitant, that is exactly what they're not anti-vaxxers. They're just really not sure because they've heard so many different things. So I think it's important to remember that your pediatrician, your primary care physician is always a great source, somebody that you trust to ask questions. And a lot of times when I talk to families that are vaccine hesitant, they're just not sure. I'll start with, okay, well, what do you know? What are you concerned about? What have you heard? And I feel like that gives me a really nice starting point to kind of see where they're at. And then I just open it up and ask them for like, well, okay, so if you've heard that, what questions do you have? And we just kind of work through it. And a lot of times it's just, they just want somebody that they trust to talk to about the questions that they have.
Now, as Dr. Mourjani said, the best thing you can do is talk to your child's pediatrician. In the meantime, we have lots of resources to help answer your questions. Just head over to ClickOrlando.com/vaccine.